And so the first study we tried to investigate in our cardiovascular health study was whether or not there was a relationship between obesity and the actual structure of the brain. Now you might ask yourself, why would obesity be related to Alzheimer's disease or brain shrinkage? Well, one of the talks we've been hearing about over and over again in terms of the themes of these meetings is the idea of how inflammation can be bad for the human body and bad for the brain. And when an individual has too much body fat, it acts as a huge pro-inflammatory organ, dumping inflammatory cytokines, molecules, and interleukins that can affect different cellular functions, and in doing so, influence the actual health of neurons and brain metabolism. Another way that obesity can affect risk for Alzheimer's disease is by affecting actual blood vessels in the brain. And so those same inflammatory markers can constrict blood vessels and reduce blood flow, and they can increase risk for other conditions like diabetes, which themselves are harmful for blood vessels and brain blood flow as well. And so there are multiple different ways through which we hypothesized obesity as being bad for the brain, and we studied that by looking at these MRI analyses. And we published that several years ago in the journal Human Brain Mapping, and we studied this question in 94 individuals from our study. And we specially picked out these 94 individuals as individuals who did not have any symptoms of memory loss whatsoever, because we didn't want to confuse any obesity-related problems with Alzheimer's-related problems. And we specifically selected individuals that we knew were cognitively normal at the time of our scan and stayed normal 5 years later. So we looked at the most super normal individuals in our study, and we grouped them by whether or not they were normal BMI, overweight, which is 25 to 29.9, or obese, which is a BMI of 30 or higher. And as you can see, when you compare them across different variables, one thing that we find in the obese and the overweight individuals is that they have higher levels of fasting plasma insulin. That's important because being overweight and obese increases your risk for type 2 diabetes, of which a big characteristic of that disease is a higher level of plasma insulin in the body. And what we see here is an array of side view and cutaway views of the brain, with a top row and a bottom row showing more or less the same thing. So these arrows are pointing to these blue areas, which are areas of brain shrinkage in individuals with a higher BMI. So the higher the body mass index goes up, the more body fat there is on the individuals in our cohort, the smaller these brain areas were. And the reason this is an important image is because it's showing the frontal lobes and the hippocampus, two areas that are commonly targeted by the amyloid and tau molecular pathologies of Alzheimer's disease that are being affected negatively by this rise in body mass index. And we see these colored more specifically in these body mass right here. We repeated this analysis controlling for other variables, other factors that we thought might have been accounting for the same relationship. And so we controlled for age, we controlled for gender, we controlled for race, and we controlled for type 2 diabetes, because there's a lot of literature suggesting that diabetes can be a predictor of brain atrophy and Alzheimer's risk. And what we found was that when we put all of these factors in the same analysis, obesity, higher body mass index, was the single most powerful predictor of brain atrophy. And we can see right here the same areas that were shown in the prior slide also came up in our more sophisticated analysis. So the frontal lobes, the hippocampus is pointed out by the arrows, the subcortical regions, all are smaller in volume with a higher body mass index. And what was also very provocative about this analysis is that actual relationship between age and gray matter. So everyone knows always about as you age, there's some normal age-related brain atrophy. That relationship no longer existed when we were controlling for body mass index and diabetes. And that's a very powerful concept because age is always the biggest risk factor for Alzheimer's disease. We always hear that all the time. But is it the simple passage of chronological time that's leading to Alzheimer's disease? I don't believe so. I believe based on this research, it is the cardiovascular and obesity-related complications that one is more likely to experience when they age that themselves could be a bigger predictor of Alzheimer's risk. And that's very powerful because it suggests that it's not an inevitable process, if we could control these factors, we could have a better chance of reducing this age-related risk that we always hear about. Here I'm looking at the relationship between just the obese individuals with everybody else, the overweight and obese, and we can see the obese individuals, the individuals with BMI of 30 or higher, they had the worst brain atrophy in the entire group. The overweight individuals, as you can see, their blobs aren't as big, so they don't have as much brain atrophy, but they still have a significant amount. This is a study that I like because it's showing more or less what we demonstrated in our study, but not showing it with structure. This is a study done by Dr. Wilmer and colleagues, where they showed that the actual blood flow to the brain in the frontal lobes on SPECT imaging is reduced in individuals with a higher body mass index. And what's also interesting about this study too is that they did this in a group of retired National Football League players. And so the suggestion there is that even in some groups with brain trauma, which we know could be an individual risk factor for Alzheimer's, having a bad BMI profile on top of that can make the blood flow worse than it could in individuals who are otherwise normal weight. And so what BMI probably does through the increased body fat is exert multiple inflammatory and constrictive actions on the blood vessels that could then reduce blood flow and in the long term reduce brain volume and gray matter, as we showed in our study.